Constipation is a common problem. It affects around 27% of general population, and constipation defined as fewer than 3 bowel movements per week, or infrequent bowel movements, or difficulty passing stool and sensation of incomplete bowel movements. Most common cause of constipation is poor diet. Poor diet defined as diet which is low in fiber and high in processed foods. Poor diet is 50% of cases of constipation. Second most common cause of constipation is dehydration. Dehydration occurs around 10% of cases. And another common cause is lack of physical activity. Sometimes ignoring the urge to have bowel movement can also cause constipation. These 4 conditions like poor diet, dehydration, lack of physical activity, and ignoring the urge to have a bowel movement can be considered as functional constipation because we have no physical substrate of disease, but they all are environmental factors. What is treatment and what is recommendations in case of functional constipation? First recommendation is increase fiber-rich foods such as fruits, vegetables, and whole grains. Limits consuming of processed foods, animal products. Drink plenty fluids, especially water. Drink at least 8 cups of water per day. And exercise at least 30 minutes of moderate intensity exercise, such as brisk walking every day. That's the general recommendations in case of functional constipation. Another important cause of constipation is irritable bowel syndrome or IBS. IBS accounts 5 to 10% of constipation cases. IBS is one of the most important bowel disease because it affects around 10% of world population. What's the symptoms of irritable bowel syndrome? It affects usually large intestine, and most common symptom is abdominal pain and discomfort, relieved by passing stool. Changes in bowel habits is important characteristics where we have diarrhea, constipation, and combination of these two. So we have diarrhea and constipation, and we have these 2 symptoms in combination also. It affects usually people less than 45 years old, and it affects around 10 to 15% of world population. Now, what is the treatment of irritable bowel syndrome? Most core management is stress reduction, increasing fiber intake, and medications. In medications, antispasmodics, laxatives, and antidepressants are important. Also, cognitive behavioral therapy and exercise have its role. Another important cause of constipation is hypothyroidism. Hypothyroidism is thyroid gland disease, which is characterized by high TSH level in the blood and low T4 level. That's the diagnostic criteria for hypothyroidism. To say simple, hypothyroidism is when our thyroid glands produce less thyroid hormones than it's needed for organism normal functioning and for normal metabolism. Most common symptoms of hypothyroidism is fatigue, weight loss, cold intolerance, dry skin, and constipation. Also, another important cause of constipation are medications. Medications such as opioids, codeine, oxycodone, and morphine are important. Also, antacids, antidepressants, iron supplements, calcium channel blockers, diuretics, and antihistamines can cause constipation. Now, let's summarize. Constipation can be functional or structural or pathological. Functional usually caused by environmental factors such as poor diet, dehydration, lack of physical activity. In case of pathological constipations, most important disease is irritable bowel syndrome. Irritable bowel syndrome is combination of diarrhea and constipation, and it affects around 10 to 15% of world population. Another important disease is hypothyroidism, which affects usually women, and it affects around 4% of world population. It's also very common disease. And we should not ignore medications, especially common medications such as diuretics, antihistamines, and iron supplements. Thank you for watching. Thank you for your interest. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.